everyone. You're joining us today with Dr. Sedgwick. We're here during the month of August, which is National Breastfeeding Month, and we're going to hear a bit about your experience and journey in breastfeeding.
So this is my view as a provider. Benefits for baby, nutrition. The only thing that needs to be added to breast milk, and this is a possible, is vitamin D. I do prescribe vitamin D. I do recommend it for nursing mothers because the evidence shows that breast milk is lower in vitamin D. We don't know if there's a scientific reason that it's lower in vitamin D, but you can't get too much vitamin D, so we always supplement with 400 IUs of vitamin D. After the first month, there's nothing that's required in the first month. So complete nutrition, it's complete nutrition. It is convenient, it is always with you, it is cheaper than formula, so if finances are an issue, breast milk is the way to go. There are antibodies in breast milk that protect an infant from both viruses and bacteria, and the first milk, the colostrum that comes in, that's the highest amount of protein and those protective antibodies, so you want to make sure that the baby gets those first couple of days where the colostrum is thicker, it's usually a darker yellow than when the breast milk comes in later. The composition of breast milk changes throughout the first year of life. Don't know how it does that, but it does based on baby's needs. It also adapts. Babies don't overeat when they're breastfed. They tend to self-regulate better, which sets up healthy eating habits long term. It promotes healthy weight. So in addition to weight for the baby, in addition to developing good eating habits, breast milk has been shown to reduce the risk of obesity. I think there's one or two more that I'm missing, but I might have to come back to them. So benefits for mom. It's been shown that every time you nurse the baby, the uterus contracts, so you're going to get back to your pre-pregnancy body faster by nursing. There is also more chance to lose more weight. It consumes calories. Breastfeeding a baby uses calories to do it. So there is some science behind the fact that breastfeeding moms will return to their pregnancy body, and maybe not the weight, but it'll certainly come off faster than if you choose to bottle feed. We already talked about economics, so that impacts parents as well. You have a lifetime protection or a reduced risk of breast cancer and ovarian cancer by breastfeeding. The percentages are anywhere from 25 to 50% depending on how long you breastfeed. And breastfeeding can happen, when you talk about total breastfeeding time, it's not just one child, it's all children that you breastfed. There's a cumulative factor. So if you breastfed for over a year between two children, your risk decreases for those disease processes. Oh, I know I was going to talk about for babies. The decreased risk of type 1 diabetes, type 2 diabetes, leukemia, lipid control, and high blood pressure. That was it. All right. Personal point of view. It's convenient. You didn't have to get up in the middle of the night to fix a bottle. Just throw them on and there you go. I really liked the economics, especially when I was nursing twins. That was a huge deal because just diapers are expensive. You add formula to it, it's like $1,000 a month. Nursing in public. Let's talk about nursing in public. I have a real beef with anybody who gives me a hard time about nursing in public. It's really none of their business, quite frankly. And you know what? It's kind of fun to tell them that. Mind your own business. You can say that. It's okay. I also didn't cover my babies up. It's fine. You don't have to do that. There's nothing bad or weird about nursing your baby. It's a perfectly natural thing. It's other people's problem, not your problem. And it's really important to remember that. It's calming. It makes you just like stop. It's a good chance to drink water, which you should always do. Always grab a bottle of water before you're going to sit down. I think it's peaceful. It's about it.
Any challenges that you encountered?
Oh, teeth. Teeth are a problem. But usually it's a harsh no to the baby. You just pop them off and say, don't do that anymore. They get the message pretty quickly, you know. It's not fun. You might take a couple of hits, but you know, you'll recover. It'll be fine. I promise. Other challenges. I mean, when you're traveling, it can be a little more difficult if you're traveling in a car, because in a car, in theory, you know, you're supposed to take your baby out of the car seat and put them in a bottle, but we know people don't do that. They just shove the bottle in the kid's mouth and then they're stuck in their car seat. You can't do that necessarily while you're nursing if you're actively nursing. However, you can pump. You can pump and put the milk in the bottle. I do recommend that. Actually, from the point of 4 to 6 weeks. I usually don't even tell people to wait till the 6-week mark, because babies get really smart. If you just are totally taking baby to breast and try in the first couple weeks, oh yeah, they take a bottle, that's great. And then you don't do it for a while, yeah, the baby's gonna figure that out. And so when it comes time to leave the baby with somebody and you wanna leave, they're not gonna take the bottle, they're gonna scream. Learned that with their first child, yeah. I thought, oh, this will be fine, I'll just leave the bottle with her. No, I got a frantic call from my friends who are babysitting, like, it's been 3 hours and she won't eat anything, she won't take this bottle, she's screaming her head off. And then I was sort of stuck until 6 months of age when they could start taking a cup. So yeah, all the other babies got 1 bottle a day at 4 weeks going forward. It was breast milk. I did pump and have breast milk. I did breastfeed all of my kids. I have six kids, and I breastfed all of them for a year, excluding the first one. And I stopped breastfeeding her at 8 months because I got pregnant with the second one. We can talk about that. Contraception and breastfeeding. Yeah, it only works for a little bit of time. This is the problem with that. They say that you can rely on breastfeeding as a contraception. Not a good idea. This is why I have a second child. So when you first start breastfeeding, what's preventing the ovulation is the change in rate of how the baby eats. So if they're not on a schedule and you're really demand feeding and you're going 2 hours, then 4 hours, then 3 hours, then 1.5 hours, then 4 hours. Your body is in a state of, I don't know what's happening. And that state of, I don't know what's happening is what prevents the ovulation. As soon as that baby establishes a rhythm and they're going every 2.5 to 3 hours consistently, your body changes back into baby making mode. So it's gonna start ovulating again. So my message is, don't count on breastfeeding as a birth control method. Make sure unless you don't care, if you get pregnant again right away, if you care, then you're gonna wanna get some sort of actual birth control on board. And there are plenty of options of birth control, excuse me, that are safe and effective while you're nursing. So you can talk to your OBGYN about that. It's a good conversation to have. Some inconveniences. Leaking. When you start breastfeeding, you're going to have a big letdown. And the side the baby's on is going to be fine. The other side is not going to be fine. It's going to start leaking. So you need to be prepared. You want to have cups or pads in place with you at all times. When you're in your house, when you're not in your house, you need them. And if the baby starts crying and you're not in a convenient place to nurse at that moment in time, you're going to have a letdown. So just make sure you're prepared for all of that. I know a lot of people feel embarrassed about it. Again, this is a natural thing. It happens naturally. You have to get it in your head that it doesn't matter. What other people think doesn't really matter, and it doesn't when it comes to feeding your baby. So I think that's about it. Is anything else you want to know?
No, I think that's great. Thank you so much,
Yeah,
Dr. Sedgwick,
sure,
for sharing both your pediatric experience as well as your personal experience breastfeeding.
Absolutely.
Thank you.